Hello, I'm Dr. Tim Sandle, and this is the latest in my video on the coronavirus series. And today I'd like to address the aspect of weather and climate and COVID-19 infection risks. And this all rests on a predictive model. But before doing so, I'd like to highlight some other research that is also using a predictive model just as a way of a short lead-in. So with this latest predictive medical model comes from Johns Hopkins University. And with this, researchers have taken a series of factors to create a model that can assess how serious a coronavirus infection is likely to be for a given person. And the factors they used for this analysis was the patient's age, their body mass index, lung health, and signs of other chronic diseases, as well as some other vital signs, and also the severity of the conditions of the patient when they were admitted into a hospital setting. And this has led to a computer-based model being generated, which is called the COVID inpatient risk calculator. And this has been put out for free for medics around the world to access, and in fact any member of the public can also look at this if they so wish. So if you're interested in that, then you can check out the COVID inpatient calculator. Now, going back to the main subject, in terms of climate, a research group maintained that as COVID-19 cases increase, then understanding how climate affects the coronavirus becomes more necessary. And as it stands, that aerosol of respiratory droplet transmission is well known to be a primary vehicle for the rapid spread and continued circulation of viruses in humans. And there's also strong support that environmental conditions will also affect the rate of virus transmission. And with the specific SARS-CoV-2 virus, the causative agent of COVID-19, medical data has consistently detected traces of the virus in the saliva of infected people. So all of this can come together, and this research group have maintained that it's possible to construct a predictive model on this basis. And such factors are of particular importance as winter virus infections are generally more common, particularly for those based in the northern hemisphere who are about to experience cooler temperatures. So to this end, the scientists have studied the impact of relative humidity, environmental temperature, and wind speed in relation to the human respiratory cloud and also with virus viability. And the key aspect from the research relates to a critical factor for the transmission of infectious particles or virions, especially when they're immersed in this kind of respiratory cloud of saliva droplets. And this key factor is the rate of evaporation, and evaporation is influenced by the relative humidity of the air. So the importance of this is with the way that heat and mass transfer around the respiratory droplets affect the chance of infection, and that's especially so indoors in a closed environment. Now, conversely, the optimal conditions to reduce the chance of coronavirus infection are environments with high temperatures and with low relative humidity. And this is because such environs lead to a high evaporation rate of the saliva contaminated droplets, and this is critical for reducing virus viability. And the researchers have called this phenomena the saliva liquid carrier droplet evaporation rate. However, even under these optimal conditions of high temperature and low humidity, the virus can still spread. And this is due to another factor that needs to be accounted for, and that's wind speed. And this means that the wind outdoors or air movement inside, as might be generated through an HVAC system and the relative air changes, is also of importance. So this means that understanding aerodynamics might be another factor to consider when drawing up social distancing guidelines. And that's something I've discussed in other videos in the series, the fact that perhaps 3 metres is a better distance to avoid viral contamination, albeit not overly practical in many situations. So the significance of the research could lead to a better understanding of the evaporation and how this connects with climate effects. And this could become the basis of a workable model, which could enable scientists to better predict coronavirus concentration, and hence to assess the viability of the virus, or at least the potential for virus survival. And such a model is possible to develop through the use of computational fluid dynamics. And the researchers have drawn on in their paper a very specific model, which is called the three-dimensional multi-phase Eulerian-Langarian computational dynamics solver. So that's a bit of a mouthful, but it's an established model that focuses particularly on aerodynamics. And to develop this model for the coronavirus situation requires an understanding of the steady state of heat and mass transfer in relation to flowing spherical particles, as virus particles would be in a stream of ejected saliva, such as when we talk, cough or spit. And what was most complicated with drawing up this model was assessing the vapour film thickness around an individual droplet carrying a viral particle or particles. So we're talking about some very complex calculations and scenarios that form the basis of this particular model. Now, importantly, such a model cannot predict if someone is likely to become infected, because that depends upon the viral load, and scientists are still not precisely sure what level of viral load is required in order to produce a infection. And also there's particular factors relating to the individual as well, such as their age, their gender, whether they have any underlying health conditions, and also possibly genetics. But what this model can do as it develops further is with helping with building design and with social distancing indoors and outdoors, and also offer guidance on the optimal environments required to lower transmission. And we already know that from other research that lowering humidity in buildings can help to decrease the rate of infection, and we also have this now added research about warmer temperatures as well. And the model also shows that social distancing remains of great importance, but this is both in a stream-wise, that's wind direction, and also a span-wise direction. So it's very important not to think of social distancing as purely a linear concept. It needs to be considered in terms of a 360-degree aspect. Now, going back to something I said earlier, that of concern for those living in the northern hemisphere as winter approaches will be the combination of low temperatures and high wind speeds and variable humidity. So these are all factors that could increase the airborne survival and transmission of the coronavirus, at least based on this new research. So it kind of ties up with some other scientific thinking that the winter poses a greater threat than the summer. So there's some interesting theoretical concepts here, and hopefully this will translate into some more practical based research. Now, as always, I recommend that you always check out the research for yourself and never just take my interpretation of it. So this study has been published in the journal Physics of Fluids, and the title of the paper is Weather Impact on Airborne Coronavirus Survival. So if you Google physics of fluids and weather impact on airborne coronavirus survival, you'll stumble across the paper. The paper is not hidden behind a pay view, and it's free to read the entire paper. Okay, so that's it for this video. Please like the video if you have found something of interest, and also to receive updates to other videos in my series, please subscribe to my YouTube channel by clicking on the link below. Okay, so that's it. I'm Tim Sandle, and as always, please stay safe.